briefly about the Refugee Council. Our director, Fazil Kawani, will join us at a later stage. He has a medical appointment, so he won't be able to come. And he will be able to tell us more about the history of Refugee Council and the integration section which he's heading. Just briefly, the Refugee Council was set up more than 60 years ago in response to the crisis after the Second World War. And it reflects the statement of the Geneva Convention, where people who have been forced to leave their country need to get protection in the countries where they settled as refugees. So 2 years ago we celebrated our 60th anniversary, and Refugee Council is one of the biggest charities in the UK that looks after asylum seekers and refugees, and there are different sections within the council. We have a policy section which is responsible for different campaigns, making sure that the voice of refugees is being heard and that policymakers do take into account all the issues that affect asylum seekers and refugees in this country. There are other sections, such as a children's section. They are looking after unaccompanied children who end up in the UK, who need protection and need care up until age of 18 and then afterwards. And part of the integration section is to do with employment. Although it is very difficult to take just the employment as an element of the integration. Mm-hmm. There are different issues, and that could be anything to do with housing, accommodation, finding suitable property for people to stay, supporting families to place children in schools, helping people to access health and social services, and then help people to train or retrain in some cases and access the labor market. So we have this small section within the integration which is called Refugees into Jobs, and Bahar's coordinating the employment projects. I'm heading this project for health professionals, and we can tell you briefly about what we do, how we do it, and then we can hear from you how these things are being done in your organizations, and we may learn something from you. You may find something that we do useful and that something that could be applicable in your organizations and your countries. So I think if Bahar would start with our general information, advice and guidance on employment training.
Yes, I give you the list of the services that we provide for refugees as part of integration. There are different projects, as Tahira mentioned, like the housing, which is helping single people who are not on the priority of housing. It's called a rent deposit scheme, that's working with landlords to help single people to find accommodation. It's a very small project, but it helped lots of refugees to get accommodation. The other one is, before I get to my project, I have to briefly explain that help befriending project. That is, they have volunteers who befriend asylum seekers and help them to get access to health services. Although, as Tahira mentioned, it's not only one element of integration, that they come with the whole package. So it's about access to benefit, access to housing, how to access health, and
legal
and
advice.
later on get into employment. So we have a very little funding, bits and pieces. So we don't have any funding for integration as a whole team. We used to have, and it stopped 3 years ago. We're trying to raise funds to have a integration section to be able to have newly arrival and new status refugees, to be able to help them integrate, to have access to funding and benefit and housing and employment. But we try to do as much as we can at the moment. My project is to help them to get back to work. So refugees with all different backgrounds, educational backgrounds or experience from their country. they come to us, and we only support people who live in London. So they come to us and we help them to get back to work. We have a session with them, we discuss what they need to do, what kind of support we can provide for them. It depends on their need. We refer them to different services. If they need to improve their language, we refer them to ESOL courses. Do you know ESOL? It's called English for Foreigners.
English as a second language.
Second language,
Yes.
yeah.
Yeah.
And we refer them to ESOL courses, and if their English is good, we refer them to our employability workshops to learn about UK system, UK labour market, and how it works. After they've done the workshop, we also have volunteers to work with them on a one-to-one basis and help them to follow up on their action plan and find a job or placement experience that they need to do, update their CV and help them to find a job. We also help professionals who have qualification from their own country to get their qualification recognized here. And there is an organization called NAVIC that does this comparison, and they get their qualification compared to UK equivalent. We are a member of NAVIC, so we do it for them free of charge. And once they get their qualification equivalent, depends on the profession that they want to do, we give them career advice. Like teachers, they need to do a teacher's training to be able to teach us in UK. Doctors go to 5 years project, so they have another route. Nurses, midwives, all of them, they have different routes to go, so we advise them on their career. And we help them as much as we can to find placement, which is not easy to get experience in UK. To be able to apply for jobs, because without UK experience, they're not able to find any job. So it's very important. We try to establish relationship with employers or different organizations if we can help them to find voluntary work and placement to get experience in UK. We also have a mentoring project. It's not a project, it's kind of a scheme. It's not funded by the project, we're just doing it on a voluntary basis, part of the job that we do. We match them up, we're working with DWP, Department of Work and Pension, and Job Centre is part of it. So DWP and Job Centre staff have offered to volunteer their time to mentor our clients. So it depends on what they need to do. It's an additional support that we provide them, here, so they can help them. I don't know if they need to improve their English, get to know UK system, get to know about the UK working culture, office etiquette, something like that. So, yeah. At the moment, that's what we do a lot. We do also run conversation clubs for people who need to improve their conversation, which is basic. But it helps so many. It is for asylum seekers, and it's run by volunteers. So it helps so many asylum seekers who don't have access to the public fund to get education and English courses here. So it helps them to improve their English. This is our statement of service and leaflets that we have.
How many volunteers do you have at the moment?
Well, it varies because they come, they apply, and they leave. They move on and they leave. So it's volunteer based, so we can't expect much from them. But at the moment, we usually get 3 employment support volunteers. And we have our conversation club teacher is a volunteer, our employability workshop is a volunteer, trainer is a volunteer. So we usually have 3 employment support volunteers helping. We also have 2 admin volunteers that we recruited from our own clients, which is very good. So it helps them to get experience in UK and move on later on.
Yeah, we do similar things at Praxis, and take a lot of time to get them.
But are the volunteers are they of the same nationality of the person? No, they are.
No, they don't have to be.
They don't have to be.
They could be refugees. themselves, or some of them we had like solicitors who were
help.
volunteering for us,
Solicitors,
or
Probably the,
university career advisor.
yeah, if you would just say a few words about the profile of our volunteers, it's really diverse.
Yeah,
Mhm,
yeah, we
mhm.
had 2 solicitors. We had a volunteer from the House of Commons who, yeah, she really was keen to volunteer for us, and she was accepted, but because of her work, she was doing a full-time job, 60 hours a week, 36 hours a week, and she wanted to work longer hours for 4 days to make 1 day free to volunteer. But her director didn't accept. She said because of the volume of the work, she couldn't work. So we also have
Graduates
graduates
who need some
from the
experience.
university or
and
students. There are lots of them applying. They really like to volunteer for the Refugee Council. But we are very careful because we don't want to give wrong advice to our clients. So we make sure that they have some knowledge about the UK system and employment, how it works, to be able to provide. We provide training, but it's because they're here for a limited time, like 3 months. So, and they're here once a week. So we prefer to recruit people who have some knowledge and experience in UK labour market and employment.
But we can't stress enough how important this support of volunteers is. Without volunteers, probably a lot of work wouldn't be done.
Definitely.
It would be just impossible because there is no funding for these things, and the need is there. So we are trying to juggle to manage and to fill the gaps as much as we can. Of course, it has to stay within the legal framework. You can't use volunteers as a pair of spare hands for somebody that should be paid for that. So it's all about balancing. And I think the good thing about volunteering is that quite a large number of volunteers who spend some time with us progress into employment. So it's beneficial
For both sides.
For both sides.
Oh, definitely.
And do people, I mean by refugees, come here, or you have to be active to find them and bring them here?
What do you mean, to access the services?
Like to find you here in this place, for example. Or, I don't know, you know, because in Czech context we really face problem that we have to really go to streets and
To reach out to
reach them,
people.
to find them.
because,
Okay,
yeah.
yeah.
It's really
Well,
hard
our
for them.
clients, sometimes they hear from, from other friends. Word of mouth really works really well here, and also some organization, refugee communities or different organization, charity organization, they know about us, so they refer. But I had a client actually last week that he had a degree and he didn't know that he could get his qualification recognized. So he worked for three years as a security officer, and then he realized he heard from us, and then he came to get advice. So he knew, we gave him advice on how to on his career. So it's very good. The information he told me himself is that the information, lack of information, that I wasn't able to, access
Any service.
any service or progress in my own career. That's why I did security job for 3 years. But at the moment now he's trying to progress into his own profession, which was the research that he was doing from home.
There is something else, just your question about how people hear about us. We have a small network which is called Refugee Career Advisors Network, ARCAN. So Praxis, Refugee Council, some other organizations that provide support with training and employment. We meet bi-monthly or quarterly
we
now.
have a forum with refugee advisors and as well some people from colleges. So we come here or we go to other places and we have a meeting, and each one give us an update of the services, and it's very helpful. And as well we discuss legislation and sometimes things that we want to campaign or try to change. So that is networking for advisors, and from there we can cascade all the information to the client.
Hi.
Hi.
Good morning.
Hi.
Come in
Hi.
there, yeah.
Yeah, sure.
I'm sorry for coming late.
No, this is Fazil Kavani, the director that I mentioned. Fazil, we just covered briefly the Refugee Council, and we moved on to the employment
Yeah.
section. So shall we finish with the employment,
Yes,
and then
please,
you
yeah.
can
Yeah, I just want to join you, that's all.
add a little bit. Okay, so we were
Yeah,
talking about
We were saying
the next
about it's called ARCAN, Refugee
career
Career
advisors.
advice network.
Careers Advice Network. So we meet every 2 months and we discuss how can we help our clients on different projects or funding for clients.
Previously, sorry, because our funding, we had a project, as I mentioned, integration project, which the funding was from UKBA, UK Border Agency, and they used to refer clients directly from the Home Office to us. So we helped them to move on, so it was a whole package of helping them, supporting them with the integration, to access the benefit, housing. So there were people here who were able to help clients to move on. We don't have that anymore. So we used to have referral from the Home Office, so they could come to us straight away. But at the moment, it's not available anymore. So it's one of the things.
From the moment the asylum seeker arrives to England, how long does it take to be considered an asylum seeker? So in Spain, for instance, it takes a certain period of time, and until the end of this time, he's not entitled to work. He's
Well,
like in
yeah.
a kind of legal limbo.
Limbo.
you know,
There are two terms that in UK is used. One is asylum seeker, one is refugee.
Mhm.
Asylum seeker, once they come to UK, once they reach UK soul or whatever they call it, they called asylum. If once they approach the authority and claim asylum, they called asylum seekers.
He is already an
They are
asylum
asylum
seeker.
seeker, but
Mhm.
they don't have permission to work.
Mhm.
They don't have access to public funds.
Mhm.
So they, until they hear for a decision from the Home Office on their case,
Mhm.
they don't have this, the eligibility.
And how
So
long does
once
it
they
take?
get it, well,
Mhm.
it varies. Once they get it, they call refugees. So
Oh.
they're entitled to access mainstream services, benefits, housing, education, everything. But before that, they don't. And it varies. Sometimes some people here in a few weeks.
Mm.
Some people wait for years. I've had a client who waited 16 years
16.
in this country, and he hadn't heard yet. So it varies. Nowadays they try to make it quicker and answer them in a few months' time.
And the ones that takes longer, they rely on support of NGOs, or organizations like yours, or
Well,
residential
some of
housing.
them they have access to NAS. It's called NAS. Is the support from a Home Office,
Uh-huh.
and it's a very little amount of support that they get. They get accommodation,
Mhm.
but they need to go whenever they send them to. They must go to another cities or even Scotland.
Mm.
But they get vouchers. They don't get money. They get
Mhm.
like £30 a week
Mhm.
voucher. They can spend, so they don't get money. It makes it very difficult for them if they want to,
Definitely.
travel. They don't have money to pay for travel. To go to the doctor or sign at the Home Office or apply for jobs if they want to do volunteer or whatever. It's really difficult for them.
Mhm.
But once they get their answer, yes, they can apply for benefits. But before that, it's really
Although they can do some voluntary work and they can access some courses and trainings, it could be limited, but while asylum seekers. So
Yeah.
that's probably one positive side, that they can still do something. They can do some voluntary work and while waiting for
Well, at least
for the
something.
decision.
Yeah.
But it's quite limited. A good thing about voluntary work is that they will get the travel expenses paid, and they will get like a lunch voucher or money. So at least, and it's a good way to use your time when you are in that
Definitely.
kind of limbo, when you can't
Yeah.
do much about
Yes.
your status, your situation. Yeah.
Can I ask something about your Refugees into Jobs project and how long it's been running for and what impact there has been on that from the work programme? Just because the work programme is a new national programme that was introduced 2 years ago by the government to support unemployed people into work, and what impact that had.
we didn't want to apply for the work program because everybody knows that it didn't work. So our project is I'm sorry, I'm very direct. But people from the government or from the WP, all of them, they admit that it's not working. And our project is from a trust called Refugee, and started April 2011. Although we started long before that. Shall I talk about IRG?
You will
we
complicate
come,
it even
we come
more.
from another organization, another charity. It's called Refugees into Jobs. It was a separate charity, independent charity, but because it was closed, this project was transferred to Refugee Council. That's how we were transferred. It's called TUP over to Refugee Council. And but we applied for this funding from Refugee, and we got it from April 2011 for 3 years.
Right.
So we don't know what's going to happen after 3 years, but we try to raise some funding to develop the project.
And the funding for the medical professionals project comes from NHS London. We are in our 4th year now. There were extensions of the project. We started year by year, and then we were given a 3 years contract, which ends in August 2014. So we will see how things will develop further. And I'm sure you are aware that the funding cuts had a huge impact on all the projects throughout the UK, and still are having. There are still people who don't know what is going to happen next year or after a contract expires. I think we were fortunate enough to be able to carry on with the projects that Refugees into Jobs had been running previously, and that we had these extensions. So a lot of support is being provided to people of different backgrounds, and our project that supports refugee health professionals, we have seen a huge number of medical professionals requalifying and moving on to jobs in their original profession. For doctors, it's kind of straightforward. There is a clear route. There is a number of exams that they have to pass to be able to apply for jobs. At the end of these exams, they are granted a license by the General Medical Council, and that's a condition to work as a doctor. For dentists, it's General Dental Council, and for each branch of this health profession, there is a body that regulates. So we have a program which is run by 3 partners. One is called Refugee Assessment and Guidance Unit, which is part of the London Metropolitan University. There is a private company that helps with English language, with ESOL for health professionals, and Refugee Council. We are supporting doctors to prepare for these exams, to requalify. Then we help them to find clinical attachments, placements in the hospitals, where they shadow medical teams and learn by observing, and obtain a reference, which is then important once they start applying for jobs. And there is a small scheme which is set up to support refugee doctors progressing into employment, where they get a placement for 6 months. They work as paid doctors, and this is usually their first NHS job, which provides them with a stepping stone for the future jobs. We also support dentists, and our support is in terms of providing information, advice and guidance, but there is also a small fund which enables us to provide financial support. These exams are very expensive. For example, for dentists, the exam consists of 2 parts. The first part costs £600, and the second part is £2,250.
Yeah.
So for somebody who's working, who's unemployed on benefits, it's a huge amount of money. Even
IELTS.
yeah,
I need
IELTS,
to do a few times.
IELTS is 135, and there are very strict requirements and conditions attached to these, to all these exams. So we support people. We provide free courses, free preparation courses. Some here in this building, some in different hospitals. So doctors are ready. And I think when we talk about barriers that migrants and refugees as well have when it comes to accessing the labor market, first of all, I think it's the lack of information. Lack of information about the system,
how it works, the recruitment system. Then there are the differences in terms of how the qualifications are assessed. And for some professions, it's much more complicated to progress or to go back into the original profession. I used to run a project for refugee professionals. So we had lawyers, we had teachers, IT professionals, finance professionals, and that's when I realized how difficult it could be for some professions. For example, for lawyers, it is a long and expensive route to go back into employment. So we are trying to be creative. For example, if it takes time for a doctor to requalify, retrain, to go back into practicing medicine, we help them to prepare the exams, but at the same time, we help them to find some kind of intermediary jobs where they can work as lab technicians or phlebotomists or healthcare assistants. So they are, in a way, involved in the system, and that helps them to learn more about the system, how it works, once they progress. From inside.
Yeah,
and it's really important. We can see the difference, for example, with a doctor who has never worked in the UK and somebody who had some experience as a healthcare assistant on a lower level. What we encounter a lot throughout our projects is highly qualified people who are working in very low paid jobs. The word for that is underemployed. So, for example, you have an engineer or a doctor or a teacher stacking shelves in a supermarket chain, or even doing some cleaning work. So there's nothing wrong with these jobs, but if these people have already had all these qualifications gained and the experience, then this huge potential should be used.
Definitely.
And there is so much potential within these refugee and migrant communities. And even it makes financial sense. To train a British doctor from scratch in this country costs about $250,000, 250,000. For that amount of money, we can support between 10 to 12 doctors to move on to progress into employment. And it would be really useful to hear about your experience when it comes to supporting professionals in your country.
That would be like my question, because if you say we help them, what it means in terms of you help them to get information, get ready, and they are the ones who really have to go to the hospital and find the jobs, or you help them, you have some partnerships with hospitals, or where this
I would
help?
say it's a mixture of both. For example, a doctor comes and says, I'm a doctor from Iraq, I would like to go back to practicing medicine, what am I supposed to do? So the first thing would be, okay, let's see what's your background, when did you graduate, what is your experience, where do you stand, and then this is the route. You need to pass this language exam, you need to pass these two exams which will assess your clinical skills and your communication skills. And where do we start? So we would start with an action plan. These are the steps, then move on to executing this action plan. We tend to encourage people to be proactive, to do as much as possible themselves. We are here to help, but not to hold your hand all the way. We don't want people to become dependent on us, but we are here for support that we can provide. So from there, people may be sent onto a language training to prepare for the exam. Once they pass the language exam, which is quite demanding and difficult to pass, then they would come back and we would help them with the preparation courses for these, for the next two tests that they have. Throughout this time, they would be provided with career guidance and advice. They would learn about the system, about the labor market in this country, and then they would learn about the health system in this country, how it operates, what is the recruitment system, what are the routes into employment. That would also include help in writing a CV, then practice for job interviews, filling in job applications, and any other advice that may come with that. With hospitals, we have an agreement. We have a number of hospitals which provide us with these placements for doctors. But we also encourage doctors, if they have their own contacts, to negotiate, to see if they would take them on. This is extremely important because these overseas trained doctors don't have any UK experience. They don't have any reference, and this is something that once they start applying, they will be asked for. So the clinical attachment comes as a useful tool to achieve this. And when this whole circle, if you like, is complete, then we help them to train more. We help them with the language and communication skills. In this country, there is so much stress on the language and communication skills when it comes to working in the health service. In particular, the bedside manners, the communication with patients, engaging patients in developing therapy, if you'd like, managing it, and coming from different cultures where doctors have a different position, where you don't discuss things, you just tell your patient what to do, and they go and do it. There are these kind of cultural differences that need to be overcome. We have a very good language and communication skills tutor who's been working with health professionals over 20 years. So he can quickly pinpoint where people may have issues, be it in terms of pronunciation, using suitable vocabulary, and this kind of communication with the patients. So that's the support. And if you take this health element from, I think that reflects what we do with our clients in general. First of all, it's assessing where a person stands at that particular moment, and then developing an action
So then
plan.
I would just have another question in terms of funding. Do you have some criteria set to say that the project was successful? In terms of, because work with people, it's really difficult to count on, because success is different for every person. And we struggle very much that we really staff and set criteria on how many people should go through the project and what should be the result. But in reality, it doesn't work like this. So my question is more from the point of view of funders, how you
It
measure
depends.
quality or something.
It depends how you set your indicators of success. And as you know, you have soft outcomes and you have hard outcomes. Soft outcomes would be increased confidence, learning, better understanding, being able to access different services by themselves. And then the hard outcomes would be qualifications achieved, people progressing into training, people progressing into employment. So for our project, we have targets.
And it's you who choose or who decide how many people.
It has been negotiated in the beginning, and having our history, track record, we were able to guesstimate how many people may be progressing. But having said that, we always negotiate. Each year we negotiate again with our funders. That's kind of contract that we have, and we can't say, okay, this year we will do half of what we did last year. But there is always a space for negotiation. For example, we may have more people who this year will be going through the exams, but next year we may expect more people to get into jobs. So within last 18 months, we helped around 20 doctors to move into employment, which in this current situation is quite good. And since the beginning of the project, we had, I think now it's over 50 doctors who started working in the health service. Apart from this, there is quite a large number of the qualifications that people completed these trainings. And our partners, Refugee Assessment and Guidance Unit, they have targets for how many people would get into work placements, how many people would get these intermediary jobs. And we find that it's extremely helpful for somebody who has been in an intermediary job. Seems to provide so much benefit when it comes to progressing into full, into the kind of employment that matches the qualifications and experience.
Can I go back to, sorry.
I was just trying to clarify the issue of outcomes. What we have usually in these countries, output and outcomes. output is what you do, outcome is what you achieve. So the training, publicities, information, materials, these are all outputs. But the outcome is what comes out of it to achieve.
So what I was going to say is, going back what you asked about the work program, because the difference between the work program is related to the benefit that clients are getting. So because it's coming from the DW Department of Work and Pension, advisors who work with them, they are also paying for the benefit. So whatever that they're supposed to do has to be aligned with their framework that they have to be able to do whatever they're told to do. So kind of we have the independence here to be able to support them and be more client focused rather than target focused. So we are able to to support clients to be able to achieve their potential or whatever they're supposed to do or they want to do in their profession. Which is, I think I find it very useful. But in terms of funding, it's very difficult to maintain these projects.
Well, what sets us apart is taking people as they are, as individuals. Although we do have targets, we know that, but people come, we are dealing with all sorts of personalities, and some people may need longer, some people may stagnate for a while and then suddenly they move on. I find it really hard when people ask me, how long does it take for a refugee doctor to requalify? Well, it could be anything between 18 months up to 4 or 5 years. It depends. The language test is extremely difficult. It's called IELTS. You probably heard, International English Language Test. There are 4 elements: reading, writing, listening, and speaking. General Medical Council accepts a score of 7 in all 4 elements. So, say a doctor sits the exam, gets 3 7s and 1 6.5. That's a fail.
Oh.
And then they have to go back and redo it. And as it happens, on a day, you are really good when it comes to speaking and you can concentrate. So you are better in one element, but the other one goes down. And it can be a vicious circle. And people just go back and redo it until they reach the score. And we find that after that, people do move on much faster. Fabrizio is nodding his head.
It's very difficult exam, and sometimes they just give papers about, they need to describe like engineering work, a machine. And some people, they are like doctors, and so it's not...
Or a piece of art, or about an artist, or about a scientist. It's not something that is specific to...
For doctors,
Yeah.
that
For
would be
doctor
easier
or
if it was
medicine.
the area, yeah.
But they are saying doctors should really have this high level of the English language, so that is what is expected, and that holds back a lot of people.
We had doctors who attended 7, 8, 9 times, still didn't pass.
And
Some of them they just pass like after first or second one, but some
Yeah.
not.
And this exam costs now £135
Every time you have
every
to.
time.
Apart from if they need to attend the college, they need to pay for the course, and they pay for travel expenses, childcare, all the elements, all the other things.
So it's like a whole day exam, all that stuff. So people get very nervous and like...
It's difficult, and for dentists it's really difficult when it comes to booking the exam. It's like an auction. You have to sit, there is an opening day, you have to sit next to your phone, and you have to call quickly. So some of our clients engage the whole family, all the mobiles and landlines, and who gets first through asks for a place to be allocated.
Really?
Because the pressure, particularly part 2, it's called overseas registration exam. It's really difficult. You have this small window within. This time you can only book your exam, and if you are given a place, then that's good.
And that's it.
And you have to pay £2,250 for that to pass. So it's really tough. It's difficult, it's tough, but it's really good to see people moving on, and we do that. That's probably what that provides the biggest satisfaction for me in my work, in my job, and I'm sure all my colleagues. And I can tell you that every person working in here does a lot of work on a voluntary basis, because there's always so much that you need to finish, that you need to do. But I think we are happy to do it.
And do you also have people who would be really discouraged by the whole process and wouldn't reach this kind of level? And
Of
they
course.
So what they do? They just work in hospitals or different positions? Or?
Well, it depends on a lot of factors. It depends on the circumstances. We had, for example, doctors who are of certain age, where their children are already at universities, almost finishing, and after discussing all the requirements, they decided that it may be just too much for that very moment in the stage of their life, and that they wanted to go back, they wanted to work, but not necessarily to go through the whole hassle of re-qualifying. So some of them were happy to settle for some different jobs, which are not necessarily directly related to the qualification. Sometimes there are other options for retraining. So some people may decide to train as radiologists, and they would do that, and then they would get back into employment. It's very important, and we talk about this quite frequently in our meetings, to be able to manage the expectations of our clients, and to help them to see things as realistically as possible.
How do you do this?
by being very patient, by being very calm, and just going through the process and explaining how things work. And I believe we all do a bit of counseling on top of our advice related to employment. Doctors, I believe, everywhere have very high status in societies and communities where they live, and it's a huge shock. You are here, and then you go below zero, and once you kind of get out of this shock and start thinking about getting back into employment, you have to go to reach this zero again and to do things. So what I find that helps and works with people, when I kind of point out, this is a temporary situation. This is not your fault. You haven't done anything wrong. It's not down to a mistake or something. These are things beyond your control, but you should be proud of yourself. You are going back, you are fighting, you haven't given up, you have changed the country, everything has changed, but you are here, you can do it. And it's also good, and I'm practicing this a lot, when, for example, I have a group of doctors who are just preparing for the first part of the exam, and there are people who have progressed into employment. So I bring them back, and they are kind of motivational speakers when they see them, and this kind of networking is really helpful. And you can see how people's minds work when you see, okay, if he or she has done that, then why shouldn't I? And they are really, we have really good clients. Once they progress, they may come back and say, I would be happy to come and help. So we have people who volunteer and help their colleagues to prepare for the exams. And that's how it works. With some, nothing works. It's so hard. I had a client who, every time he came, he would start with, I used to have my own clinic for 19 years. And I said, well, that's great. Let's set up a new clinic, and you can have it for another 19 years. But now you have to do this. And finally, he wasn't able to go through the whole process. But something worked well. At that time, Bahar was running a community interpreting course. We referred him. He was reluctant. He saw it as beneath himself. But when he joined, he started to enjoy. And he started to do a lot of interpreting for other refugees when they went for medical appointments. And that's where he found himself. From there, then he moved into interpreting further. He gained a diploma in interpreting, and then started doing work for the court. And it was just a complete change of life for him. That had an impact on his wife. We have a lot of couples where both of them are health professionals, sometimes they become depressed and they feed off each other's negativity. And you have to pull at least one person out. Then that's when it starts changing. So that's all we can do.
Yeah, it comes to the whole package of the family and everything, because, for example, like this interpreting course helps lots of our doctors. Because, for example, I had a doctor, I was working on the third professional project as well as interpreting. So I registered a doctor who, it was a woman whose husband was not a doctor, and she had a very low confidence, and she was depressed. So I advised her to join this interpreting project, and she wouldn't believe that one day she would pass all the exams. She lost all her hope and confidence. She started doing this course, and by the time, similar to other cases, she improved her confidence. She saw other people, and this course is not easy. It's a level 3. It's community interpreting. There are lots of casework that they need to do, coursework they need to do. And getting the qualification is not easy. So for qualified, educated people, it's good. They can manage to pass. And after she finished, and I gave her the qualification, the level 3 community interpreting, she was in tears. She said, I couldn't believe I got this qualification. I couldn't believe that I passed the stage. And I said, well, I told you, you're a doctor. So you were a doctor in your country for many years. So why can't you just build it up again? And it was very good, It's a very good stepping stone for some clients to move on, to improve their confidence, to be able to think about, that they can improve. At some point.
So we have an interpreting program at Praxis, and we are recruiting now for interpreters. So if you have doctors, and I remember a few doctors that they come for the assessment. So
to attend the course. Yeah, good.
Yeah. So
What is your experience with migrants? What do you find as biggest barriers when it comes to supporting them into employment?
Well,